So we see a lot of knee pains, and a lot of our athletes, especially that have knee pain, there's really two things that we see a lot of. And it's almost always because of the same problem. So let me explain. So a lot of our athletes, especially repetitive athletes, just runners, soccer players, basketball players, etc., they're going to have knee pain in one of two spots. They're going to have it, most likely, they're going to have it on the top of their kneecap, or they're going to have it, and I see this probably more, I'd say 90% of the time, they're going to have it below, right at the bottom of their kneecap, right along this area. Things like Osgood Slaughters, all this stuff, patellar tendonitis, all these things are the pain of this lower tendon here, right below the kneecap, okay? So this goes through here, it attaches in the tibia, and then attaches to this area as well, and that's just that's that tendon that works through there, right? And so what do we do if we have subpatellar knee pain, and it's either at the base here, it's at the top here, or suprapatellar knee pain, supra above, sub below, or it's along that tendon, or even attached to the tibia. Again, Osgood Slaughters. A lot of kids have it. I had it when I was a kid. Had a lot of patellar tendonitis. Never really knew what to do except just limp through it, try to tough it out, and it was excruciating. So sitting in movies, excruciating because your knee was bent for so long, or trying to go on long rides, absolutely horrible. Okay, and so what can you do for this? What is the long-term fix for this? Again, you don't want to put obviously you don't want to put a bunch of injectables and stuff into this. What you want to do is you want to correct the problem. And almost always, now there are things you can do to help to decrease pain faster, things like laser, stem, et cetera, things that we do here in the office all the time. But the number one thing that you can do to help correct this is look at the muscle above that kneecap, because your quads and your hip flexors can get so tight that they can cause so many problems. Because imagine this is all one string, it's attached up here, it goes all the way down and attaches down here. Well, if there's tightness anywhere through there, then you can have pain anywhere through there, okay? And so if you are addressing this muscle here, the quad and the hip flexors, then and lengthening that, you're gonna feel so much better. You're gonna start to release tension off of that tendon and the tendon insertion points, and you're going to start to see that pain go away. Now, again, there are fast ways to get there. You could also do joint flossing. You could do more of a aggressive stretching technique where you have somebody actually do it for you. We use different types of technology to help to release that muscle faster, to fatigue it and open it up. There's just a lot of ways you can do that, but you want to, if you have this, that's called patellar tendonitis, Osgood Slaughters, or that, like I said, that kneecap pain above the knee. But open up and stretch out the hip flexors, and it will make a world of difference. That is the long play. Again, the short play may be a little more aggressive, where you have to go to a clinic like ours or something like it. But long term, you get this muscle longer and opened up, you're going to get that tension off of this area. It's going to make a world of difference.